I'm going to now turn the meeting over to Dr. Kim Hakimian. For those of you that are new to the program, Kim Hakimian, along with Dr. Kojaglanian, who will speak in a few moments, have really been the canaries in the coal mine, and they've really led the way in helping all of us get on top of this unfortunate crisis. Kim is an assistant professor of nutrition, an associate director of education, the program for global and population health at the Vagelos College of Physicians and Surgeons in New York. And Kim, why don't you share us your perspectives on what's happening over the last week?
Hi, Larry, and hi to everyone here on the call. I'm going to be very brief and just explain what you've already heard in the media, and then I'm open to taking any questions at the end, which is that the New York, New Jersey area is in what we call the surge. The surge is a term that looks at the rate of hospitalizations and positive cases of COVID-19. And if you can understand that the incubation period goes, for the majority of cases are symptomatic by 14 days. Some people are able to transmit asymptomatically. Some people are able to transmit before they have symptoms and then become symptomatic. And so given the spread, some people become sick, and then it takes maybe a few days of that illness up to a week or so, for some patients to enter the hospital system where they're getting tested. There's not that much community-based testing going on in Bergen County and in New York City. So the rate of positive tests for the rapid test is happening at hospital centers. And as a result, that's why we know epidemiologically that we're headed for what we call the surge. And that is why many of us will hear about people who are sick and have become positive and perhaps hospitalized or worse these next couple of weeks. What it means is that depending on how well people have adhered to the stay-in-place guidance, that after this surge, we should see the number of positive hospital cases on the decline. And what that means for our community and our community organizations remains to be seen. We are looking at data from other countries to see what happens when society goes back out and reduces the restrictions of the stay in place, and we're still collecting data on that. So there's really no policies about that. But I think our community organizations have been great. They have all reached out to their membership to offer emergency services, emergency shopping, and things of that nature. And I think that will continue. I remind everybody here, as you know, that many of our immigrant community many of our community members are alone and don't have the same technologies that we have utilizing, for example, this Zoom call. So it's incumbent upon all of us and our community organizations to make sure that we do an extra step in reaching out by the good old-fashioned telephone and check in on our members that may not have people checking in on them regularly.
I'd like to now introduce Dr. Garo Armen. Garo is well known to us, a friend to many. He is the founder and chairman of Agenis, as well as the founder and chairman of the Children of Armenia Fund. Garo is uniquely situated. He's a patriot. He's from Armenia. He knows about poverty in the villages, very sensitive to the issues of what's happening as these people are vulnerable and thrown into even more poverty. But we are also so proud of his accomplishments in science, particularly in immunology, where he's made his name and started his company. So he can talk us about the hope in medicine, what's happening, as well as what's happening in Armenia. Thank you so much for joining us, Dr. Armen.
Thank you very much, Larry. Let me paint a slightly different angle and perhaps a little more generalized perspective on what's going on. Fact is that this is a pandemic. It's a scare. It is a real scare that the world has never seen before. Certainly, when I say the world has never seen before, I'm talking about in the last 100 years. We've never seen anything like this. And I know that in the beginning of the process of the virus spreading, people were comparing statistics to the flu and saying more people die of the flu than this disease. So what are we all worried about? But having said all of this, the scariest part about this particular pandemic, this particular virus, is the fact that there are a lot of unknowns about it. We know, for example, that it is highly infectious. And we also know that patients show a pathology that is very unique. It has never been seen before. I have had conversations with a number of physicians who looked at the x-rays of patients that are going into the last phase of their disease. And they describe it as something that whereby you can take glass, pulverize it, and put it in somebody's lungs, and it's both lungs. Now, the reason I'm scaring you is because, first of all, I think we should be scared. And if we are not scared, then we won't resort to the right preventive measures, right mitigation, risk mitigation, and containment measures. For example, the previous speakers spoke about how do we reduce the chances of transmission to us and to others as well. I mean, if we are, God forbid, stricken with this virus, how do we reduce the chances of transmitting it to somebody else? And that's critically important. I run a company of approximately 300 people, and on March 3rd, I issued an order that said all travel, domestic and international, is banned. And in fact, we disallowed people even train rides and public transportation at the time, because it looked like the risk of transmission was going to get out of hand. And now that it is out of hand, as the previous speakers spoke about, please take care of yourself by containing yourself. That's the most important. Hygiene is critically important, of course. We talked about that. Washing your hands properly. There are WHO videos on YouTube that show the proper way of washing your hands. I think we need to adhere to those things. I have issued, for example, one of these types of alcohol containers, sprayers, to every person in the company, and issued paper towels to everybody so that they can make their own swipes. It's very important that you swipe hard surfaces with alcohol, 70% plus alcohol, and it's important also to swipe all handles and everything else. These are risk mitigation measures that I think are critically important. In addition to that, it's also critically important, particularly at a time when all the schools are closed and the kids have the probability of carrying this virus without showing any symptoms. So, in fact, sadly, kids can kill. And again, I'm using some extreme words to make the point clear that it's very important for kids not to be in the company of older people, grandparents, and so on and so forth, because the transmission probability is not just high from an infected person that doesn't show symptoms, but it's also that the risk of morbidity and mortality in older people is significantly higher, particularly older people that have health conditions. Now, those are the knowns, but there are lots of unknowns about this virus, and that's the scariest part. There are questions about how long will it persist, questions about will it reemerge after it persists and disappears for a while, questions about whether or not it will recur in the same individual, questions about whether or not the virus will mutate And if it mutates, then will the current antibodies that one forms naturally as they come out of this infection, or the drugs that we use to target these viral particles, will they be effective for the next version or the version after that? Now, it's because of these unknowns that the world is reacting in ways that we have never reacted in our lifetime, and in fact, in many generations, to anything like this. Certainly, you can admit that the kinds of measures that governments are taking across the world is something you've never seen before. Now, as far as drugs are concerned, as Dr. Soline talked about, there are drugs that are potential treatments. None that is a certain bet. And for example, what we talked about, hydroxychloroquine, rather. Hydroxychloroquine is a drug that's used for
malaria and
of course. It's used for rheumatoid arthritis and other types of autoimmune diseases, but it's also a drug that's been used for some time for malaria. And it is an effective treatment for malaria, of course. And but the problem, as Dr. Soline mentioned, is that if you have a cardiac condition, arrhythmias particularly, this drug can have deadly side effects. So one needs to be very cautious about it. And the emerging evidence suggests that if you use it earlier in the process, once you are confirmed to have the infection, once you're confirmed to have the infection, if you use it early in the process and you take a loading dose, so the dose you take is very important, and then taper it down, it has some benefits. Now, one of the problems with patients that progress with this disease and have severe lung infections is the fact that an autoimmune cascade starts, something called cytokine storm, which means that your immune system, because of the overreaction to the virus, targets your lungs, your epithelial tissue, as if it is foreign, and produces a lot of cytokines that cause the destruction of not just the lung tissue, but other tissues, other organs in the body, and the person dies. And so there are drugs, for example, IL-2 blockers that are available in the marketplace that have been used effectively in late-stage patients. And other remedies, such as, for example, if a person is having a breathing difficulty, it's very important for them to lie on their stomach rather than on their back, because some of the recent evidence from the ER rooms that are emerging suggests that patients that lie on their stomach or on their side do better than those that lie on their backs. These are simple things, but things that are important to reduce the morbidity associated with this disease. Now, regarding Armenia, as many of you know, the bright spot of Armenia, where the virus hasn't shown or poked its head yet, is Artsakh, or Karabakh. And in Karabakh, of course, you know, we regard Karabakh as a disadvantaged region with all the borders closed and a narrow passage that goes from Armenia to Karabakh. Is spared because all the deficits that we have regarded as disadvantages in the past. It's isolated, and it has protected itself because of it, because Armenia has also closed that border temporarily for now, other than some critically important passages. Unfortunately, in Armenia, the same is not the case. So in Armenia, we've had a steady rise in the infected individuals, and the deaths are also starting to rise. And for those of you who are capable of getting equipment, not just donating money, and not just shipping equipment, but securing procurement of critically important equipment, please contact me because we have means of getting this equipment to Armenia. And I'm talking about, for example, ventilators, intubators, masks, other protective measures. Very, very critically important for Armenia to have these things. They have some, but as the number of hospitalizations rise, I think they will be vulnerable. Just to give you a perspective about Armenia, right now we have 663, as of today, 663 positively diagnosed cases in Armenia, based on the tests that they've run. That, by the way, today is 4 times the population adjusted cases as China had at its peak. 4 times the population adjusted number as China had it at its peak. So it's a serious situation, and we shouldn't take it lightly, because for a country like Armenia, if it spreads throughout the population, then we are basically looking at a very, very morbid situation. So drugs for this are under development, but premature, of course. We are working on 4 separate methodologies to potentially get out there as treatments. The FDA has made a number of concessions to get products into the clinic very rapidly once a company files. So this is where we are. Vaccines, as was mentioned before, are early. For example, should we work on vaccines? The answer is absolutely we should work on them. But remember that we started working on vaccines for AIDS over 30 years ago, and we still don't have a vaccine for AIDS. So let's not count on something. The best thing that we can count on is prevention. And that's what we should be really concerned about, mitigating the risk of contracting the virus and transmitting the virus. Thank you very much.
Does anyone have any questions for Dr. Armen?
Hi, Larry. This is Varujan, SSN Ambassador. Thank you very much, Gato, for your very interesting presentation. And I'm very much interested, and I definitely will talk to you afterwards or tomorrow on the possible, shipments of some equipment to Armenia. Do you mean that it's possible to send from here? Because last week we were discussing, and there was a general understanding that there is a shortage of the ways to send equipment or supplies to Armenia. And I was talking to our Serpazans of East Coast today to try to launch a major, the community attempt to send some supplies. The general understanding was that perhaps we need to try to, send money via Hayastan Himnadram or coronavirus fund that the government launched. But if there is a way to send equipment from here, I would be really happy to talk to you and to see how we from here as community can send more supplies to Armenia. Thank you.
Thank you. There's definitely a way to send it. And I think, money is important, of course, but critically needed equipment is much more important right now than money, because right now money cannot buy these equipment. And I'm in touch with several suppliers of both drugs and equipment. And so we will get this to Armenia for sure.
Absolutely. Then we can talk, and maybe next week I was planning to launch some conference call between community organizations here and then perhaps we can talk before that and see how we can consolidate broader community forces to help in this endeavor. Thank you.
Happy to do that, sure. If I may add one cautionary remark to that, the virus doesn't survive with heat. So if you get anything from outside, just to be doubly sure, put it in an oven or a toaster oven and heat it for about 5 to 10 minutes at a reasonable temperature. For example, the virus doesn't survive consistently at above 90 degrees. So if you heat it for example, at 200 degrees Fahrenheit, for 5 or 10 minutes, you'll wipe out all of the virus.
Very good advice, and I think it's good that our community leaders can message that back to their constituency.
A question for Dr. Arman. Can you tell us a little bit about how the villages are impacted by the coronavirus?
So interestingly, they're not as impacted so far as populated areas of Armenia. And that's not very surprising, of course, because of the transmission rate that's higher in higher population areas. And that's one of the reasons, for example, we represent an essential industry. I'm in the biotech business. And even though there is a governor's order in Massachusetts to stay home, we have adopted a policy of social distancing people and working, staggering people so that at any given moment, we don't have more than 40, 45 people in our facility. Now, the same concept is true for villages. Population density is lower. So far, we have not seen an abundance of viral infections in the villages. Now, in addition to that, there are, of course, some potentially scary economic implications of what we're seeing right now in developed countries with a high rate of infection and a society that's basically paralyzed, right? So we worry about, for example, supply chain. We worry about the fact that, you have a narrow window for seeding during the farming season, and you have narrow windows for nurturing the crops, and then narrow windows for harvesting the crops. And so in the villages, they're pretty self-sustained. And so we're in pretty good shape so far in the villages. Now, some of the things that my organization, COAF, is engaging in right now is medical education, because there's a fair amount of ignorance. Even though the government policy is very strict right now about mitigation and containment measures, people are not really adhering to it across the board. So our organization is educating about the importance of some of the measures that we talked about earlier, so that we can keep our social distance, containment, stay at home, don't do silly things to contract the virus or transmit it. And so in addition to that, we're also teaching about treatment methodologies, because it's very important, for example, for somebody who has symptoms but has not been tested yet, to know that as soon as they have breathing difficulties, as soon as they feel it, for example, what does the breathing difficulty mean? Not temporary difficulty of breathing, but for example, if a person is having difficulty in going to the bathroom without getting terribly out of breath, then you've got a problem, and you immediately have to go into the hospital for that. And that kind of education is critically important. In addition to that, there's psychological and sociological trauma. So our organization, again, has a widespread capability to make sure that people are not traumatized, because if you're educated and if you can take the appropriate measures to protect yourself, your family, your society, then there's less reason to be traumatized. So all of these things are critically important. And God forbid, if, for example, Yerevan is totally paralyzed, because, if you think about what's going on in the world right now, in our country here, in America, we cannot help ourselves, right? I mean, we have shortages of everything across the board. The governor of New York, for example, is declaring that in a few days we're going to run out of equipment, we're going to run out of supplies, we're going to run out of protective measures. So we're certainly not going to get help from America if we need help in Armenia. We, as diasporan members, need to close that gap and do whatever we can to protect the country. And also importantly, we need to teach the villages that not only do they have to be self-sufficient themselves, we have to resource them to make sure that they also have the appropriate means of potentially helping Yerevan should Yerevan run out of food supplies and other things that they need for sustenance. So these are the kinds of things that I think we need to take seriously. We can't go about our business as if it is, you know, normal business, if you will, as usual. So we need to really take this pandemic very seriously.
Are there any other questions for Dr. Armen?
Larry, I'd like to add a few more things on our efforts with Armenia, if I may.
If you can introduce yourself.
I'm Gregory Boyrazian, Executive Director of Armenia Fund USA here in Los Angeles. We've been working very closely with doctors and the Armenian American Medical Society here in Los Angeles, along with Dr. Viken Sepilian and Dr. Shan Shakhardumian. So in regards to obviously supplies, as you know, we have shipped supplies about 3 weeks ago, and obviously we have ongoing challenges. One thing that we're doing very closely, we're working very closely with the Armenian government with having some smart suggestions and workarounds. And this is all coming in input from the COVID-19 task force here in Los Angeles. And as you all know, in your respective cities, there are many specialists, whether they're, you know, pharmacists or infectious disease or critical care. So one area that we've been intensely focusing on, and perhaps it might be a little sort of a gold mine that that Armenia is actually sitting on, is how to flip anesthesia machines into ventilators. And the FDA and the CDC recently approved in the United States for anesthesia machines and to be used as ventilators. Now, that's of course stemming from the fact that all non-essential surgeries are canceled. So you have a bunch of operating rooms that have plenty of good anesthesia machines. Now, to do that properly, there's a little bit of a workaround with biomedical engineering technicians and also anesthesiologists. Anesthesiologists here in the United States are on soft standby, I'm sure most of you probably know as well, in New York, to help manage an anesthesia machine to be used as a ventilator. Now, we've also located a company that essentially is also, that recently acquired FDA and CDC approval on how to split an anesthesia machine into two to properly vent two patients. So essentially an anesthesia machine has enough horsepower to ventilate two patients that are gonna need this. And we are working actively in introducing that to Armenia as well. Now, with our friends and colleagues in Armenia have been very responsive. As you all know, there are a bit of challenges because a lot of the hospitals and a lot of the prominent hospitals that have one of the best equipments in Yerevan are private, but everybody has been very forthcoming in sharing resources and information. I think this is very helpful as well. So obviously, you know, it does remain a priority. We recently acquired 7 ventilators, brand new ventilators from China, brand new, that are being shipped to Armenia as we speak. But sort of a plan B that we're actively pushing, and we hope we don't get there, but we also want to be ready, and so do our Armenian colleagues, is to properly flip anesthesia machines into ventilators and to properly split that. And just this morning, Viken and I, we were discussing on the possibility, there's another FDA CDC approval of how to properly use Bipap machines, not for COVID patients, but Bipap machines for patients that would require, you know, assistance. Essentially, obviously, we do realize that if all ventilators go to COVID-19 patients, then there's obviously people who are still going to need ventilators, people who are emerging out of, I don't know, emergency open heart surgeries and all that. So we're trying to align all the pieces and resources, and we are making pretty good progress, all with input from clinicians and experts here in Los Angeles who, you know, are providing a lot of this valuable information, and we're sharing that with Armenian clinicians.
Thank you for that information. What we're going to do is have Dr. Carl Dogramy talk to us about preparedness. Fortunately, he is in Philadelphia. He sees what's going on around in New York and others, and is just waiting for this tsunami to hit Philadelphia. Carl is in an unusual position. He's at Jefferson University. He directs the Sleep Disorder Center. He's a full professor, and he will give us some tips on how to sleep as we get anxious about all these problems. Carl, thank you so much for joining us. Carl also is the president of the Delaware Valley Armenian Physician Association. And can you tell us a little bit about what you're learning from the New York experience, how you're preparing for what's coming your way, and please take it away.
I'm going to actually, show some slides. One of the big concerns is employee mental health, morale. The fear of exposure, of course, is one of the biggest concerns that employees have for themselves and their families. Long work hours, many are being called to work a shift, double shifts in some cases where their services are critical. Others, paradoxically, don't have enough work. I mean, where they're being not laid off, but working shorter hours, and in some cases, not compromising their pay, I should say. There's a sense of occupational uncertainty, economic hardship. Many of our employees are spending long hours at home, working from home, but also in isolation because they can't leave the house. Psychologically, we're seeing symptoms such as anxiety, depression. In some cases, these are folks who've had these symptoms before, but they're becoming reactivated in this stressful situation. Insomnia, an area that I specialize in, is very, very common. Fatigue, sense of hopelessness, despair. These are very common symptoms in this population. We have a number of psychological resources in-house. For example, we have online mindfulness training sessions, stress reduction classes online, as well as in-person classes. Individual counseling sessions have been established. Our Department of Psychiatry has a number of psychiatrists and psychologists who are volunteering their services for people who need the help. From an occupational standpoint, a number of resources have been brought to fore, such as donation funds to benefit employees who are being who are going to be in a bind with pay and resources. The donation fund is now up to close to $1 million. We're providing alternative work options for many of our employees who do not have work because of their occupation they're in, and putting them in areas of need. So we're trying to be as creative as we can. Sleep. Larry asked me to talk a little bit about sleep. The thing that I find that's interesting about patients that I talk to on a telemedicine visits, and I do quite a bit of them on a daily basis, is about half of these patients that I talk to are in their bed during the day when I'm speaking with them. So clearly patients are spending a lot of time lounging around as opposed to being active and throughout the course of the day and in a light environment. So the biggest advice I'm giving patients is make sure you have a dedicated bedroom. That is a bedroom you use only as a bedroom, and don't use the bedroom for anything else. We need to make sure we divorce night from day. They were separate when you were working, and they should remain separate when you are at home. Comfortable bed, noise-free surroundings, do something relaxing prior to bedtime, get the stress out. And there are a number of stress relaxing or stress diffusing exercises that are available. And regularity of bedtimes. Many people spend long hours at home, sleeping longer hours, diffusing their circadian rhythmicity. Of course, avoiding caffeine, late meals, alcohol, brightening the day with lots of light. We have a number of artificial light sources for people who work in environments that are dark, that emit 10,000 lux of light. But the environmental light is adequate this time of year for most patients, most people, most employees. No napping, a daily activity routine. Go to the, if you have a gym at home, exercise regularly. If you don't have a gym, exercise outdoors, take a walk in an area that you can distance yourself from others. And by all means, set aside a worry time. Many of us don't really spend much time on ourselves, worrying about our psychological issues. And I actually ask these employees who are concerned, and patients as well, for about half an hour, set aside 30 minutes, do nothing, go into your room, isolate yourself, and simply think about your concerns. Many times, thinking about our internal psychological issues brings these out to conscious awareness, and they're more likely to be resolved. So those are some of the things we've been doing in anticipation of the surge. I can't tell you that we are prepared entirely, but we are, because of the models from New York and from northern New Jersey, we've learned a great deal, and I think we're in a much better position now than we were about a month ago.
We're going to go to Dr. Supelian. Viken is a friend. He's very hardworking. And Carl, you may have to give him some sleep advice. He's getting about 4 hours a night. But he's the president of the Armenian Medical International Committee. He's an infertility specialist and reproductive endocrinologist. Dr. Supelian, can you give us a little bit idea about the relief efforts, where we're going, and share any other ideas that you have with us?
I'd just like to just briefly summarize what we've done in the past week. Many of us have been very, very active. And like Greg said, Greg from Armenia Fund, we have been working very closely with Armenia and have been keeping daily communications multiple times a day with the Office of the Commissioner, Diaspora Commissioner, and as well as the Ministry of Health. Several fronts that we're trying to tackle on is, one of them is to try to procure any type of supplies, and we have been mildly successful. We were able to get some protective gear, industrial protective gear that's made by the same companies that provide these gear for medical supplies, mainly stuff that's used by painting and auto body shops and so on. And we were able to secure some yesterday, and we delivered, I'm not sure, Greg, you probably did the count, but maybe about 10 or 20 boxes of these that should be shipped sometime soon. We're also constantly on the lookout. Just today, Greg and I were in touch with a company that's able to provide us with 4,095 masks at a reasonable price, somebody who's familiar to us, so not just some stranger, out in the, we're very mindful of, there are a lot of scammers out there. So we're working very hard in trying to find if there are any ways that we can secure supplies. Second line of attack is to transfer any type of technology or any type of medical know-how. Greg already alluded on some of the technology in terms of converting some of the anesthesia machines into ventilators, and with the strong contacts that Armenia Fund has because of some of the previous mission-based trips that they have done. So those expertise are readily available and have been willing to help us or help Armenia in converting some of the resources that are available to maximize its impact. Third is sharing any type of medical knowledge. And while we're all kind of stuck in our own areas and all hands on deck where we're needed in our own communities, we have launched a webinar program, an educational webinar program. And we have been working the Armenian Medical International Committee along with the National Institutes of Health in Armenia, and to provide any type of hands-on know-how that we can transfer. So we launched the first webinar actually last night. So the NIH was able to invite some of their physicians who specialize in critical care. These are the doctors that are working in the intensive care units. And we had several of our intensive care specialists from here, from Los Angeles, to hold this short presentation followed by specific Q&A sessions on clinical scenarios and so on. and it went very well. It was very well received. Two of our critical care doctors here locally. It's actually was very humbling and inspiring, because one of those intensive care docs specialists, he himself got infected and tested positive for COVID-19, and however has been responding to any requests that we have reached out to. He's obviously working from home. Luckily, he is safe. However, was willing to do whatever he can to help, help train or help advise or make himself available to any type of scenario that may arise in Armenia. This series is continuing. The second webinar is going to take place on Sunday, and the webinar on Sunday will gather infectious diseases specialists. So we are going to get a very broad perspective from specialists truly on the front line in Europe, on the East Coast, and on the West Coast. And we have simultaneous professional medical translations that are going on. This is moderated and observed by, very high level NIH directors, as well as individuals from the ministry and the Diaspora Affairs Office.
That's really awesome, everything that you're doing and helping the community so much. I just want to also mention to everybody, and there are people on the phone who've taken advantage of it, AAHPO, through the gracious efforts of Vartan Abdo, as well as through the efforts of Katerina Kocherian, Voice of Armenians, who's on the phone with us today, have created opportunities for anyone to create content to communicate with your constituencies. And again, some of you have already taken advantage of that, and we look forward to helping you with that. So just let me know, and we have those capabilities. We're going to now shift back to Armenia. We're so fortunate to have Sean Shirkerdimian with us. He's a medical physician, surgeon, pediatric surgeon, as well as a degree in public health. He's at Ronald Reagan UCLA Medical Center and the UCLA Mattel Children's Hospital, UCLA Medical Center in Santa Monica. And I can tell you, his fingerprints are all over the relief efforts that we're doing, and we very much appreciate everything, Shant. Can you fill us in a little bit about the situation in Armenia now?
And thanks again, Larry, for organizing this for yet another week. So since the last time we spoke, unfortunately, the last 24 hours have been not so positive in Armenia. We had over 90 diagnosed positive patients in one day, and our number of deaths has just risen over the past hour to 7. And so in terms of those numbers, hopefully we are starting to see the tail end of this steep incline, and soon we will see things plateauing off. And if the more aggressive sort of stay at home and /lockdown / decrease mobility measures that started about 10 days ago and were made more strict about 5 days ago are being enforced and people are complying with it, then hopefully we will see things plateauing. But nevertheless, the last 24 hours have been a little disheartening. The government and the Ministry of Health, Ministry of Emergency Services, and the State and Health Labor Inspectorate have been working very, very hard to make some major tectonic shifts in hospitals and patient management and patient flows. So now the second largest hospital in Yerevan, Subgrigor Lusavoric Hospital, has been emptied out of all non-coronavirus patients, and the hospital will be used for management of patients with this condition. Hotels are being used for quarantining. Stadiums are being reconfigured so that they can house less severely ill patients. One thing that's being done that's different from what we are doing here, and from what many other countries have been doing is, as of now, until today, every single patient with the diagnosis of coronavirus has been hospitalized, which again is not our practice here. If we're asymptomatic or otherwise doing well, we haven't had to be in the hospital. And there's been discussions about whether that is going to be sustainable and whether we need to continue to do that. At some point, the hospitals are going to reach a saturation level, and we're not going to be able to do that. I would say again, it seems like the ministry and the government have been able to stay a step ahead in terms of their planning and contingencies and ability to sustain themselves with regards to the growth of the number of patients. The other thing that Viken had alluded to, the talk or the webinar that we had yesterday, I would say, being an observer on that webinar, I was absolutely amazed with the quality of our frontline physicians, the questions that they were asking, the medications that are available to them. Soline, I think you're still on the call. We were having discussions about nuances of IL-6 inhibitors and really top-notch critical care being delivered to the patients, which was fantastic. I know on prior calls we've had some concerns about sort of knowledge and quality issues, and as we do these webinars, we'll learn more. But at this point, I think all evidence points to our frontline providers being at par with most other countries. Artsakh remains without any documented cases so far, unless anyone else on this call has any further newer information. They did went ahead with the elections a couple of days ago, and I don't know if it's on the political side fortunate or unfortunate, but certainly on the public health side, it's unfortunate that it led to a runoff and requiring a second election. And so I know there's many of us on the call and elsewhere that have concerns, at least from the public health perspective, of having these elections, but that's the update from that side. I think that's it from my end.
That's a wonderful overview. Shant is a reservoir of amazing information. Does anyone have any questions for him?
I have a question for Dr. Sepilian. May I?
Sure.
Viken, I understand you're doing a series of webinars. Currently, a group of us, a task force of the Armenian American Mental Health Association, is also developing webinars and YouTube presentations and hopefully TV presentations as well. Are you planning to have a mental health focused webinar anytime soon at the county level?
Yeah, so we have, we're creating content on two fronts. So, priority number one is the webinars are, there's content that's being created that is going to Armenia at the level of preparing the Armenian doctors, and that at a level that is appropriate for their frontline preparedness and battles. So these include, we started off with critical care. Sunday, it's going to be infectious diseases. Next Thursday is going to be radiology. We have some radiology specialists. And we have nursing that is working. Their nursing is actually going to hold their webinar on Monday. And these are the topics that we're geared toward Armenia.
If I may just make one follow-up comment I forgot to mention earlier. I'm sure prior to me signing on, there's been other discussions about what we from the diaspora have been doing and the difficulties and the challenges, because we're all limited by the shortages and the issues that permeate every hospital and every institution we work at. But when we're thinking about Armenia, one thing that is, I think, becoming evident and will be more and more on the forefront is actually issues with regards to healthcare, which is our sphere, but all sorts of downstream issues, but particularly in healthcare, downstream issues that we're going to start to see with the disruptions in supply chains, with the closure and cancellations of flights. And so while we remain very limited in providing the stuff that Greg and Viken have been miraculously been able to get to fight the coronavirus situation, if I can just plant the seed in government officials on the call, as well as NGOs or other stakeholders, that I'm fairly certain that pretty sure we are going to start to get the asks about the other things, whether it's the insulins, whether it's the other medications, whether it's the other needs that are going to come when a geopolitically difficultly positioned country with now closed borders or even more closed borders and limited flights will ultimately come up against. So let's just please have these in mind, and rather than only focusing on the current issue, if we have opportunities to start to think about that, to plan and be a step ahead, that would be a golden opportunity for us, rather than it being a missed opportunity several months down the line.
That was a very good point. Does anyone want to make any comments about that?
Yes, actually, to echo what Sean said, so in parallel to what we're working with the medical relief efforts, we are actually working on sourcing new laptops and tablets to help the Armenian Ministry of Education. There's a specific request to help bolster their virtual remote learning environments. We're trying to help them boost their infrastructure, simply because there's a shortage of laptops, tablets, and that's something we're working with Silicon Valley partners here in California in trying to get that to Armenia. So there is a big need, Shant, as far as that is concerned.
I will tell you, even before the borders closed, even for hospitals and organizations that had the money to pay for supplies and medications, the local regional wholesalers in Georgia and Russia, because they were worried about their own long-term supplies, were unwilling to sell Armenia the medications that some needed. And so if we can position ourselves again to take advantage of our vast diaspora resources and just think about it, I think it'll be a wise step.
I want to thank all of the speakers who presented tonight. I want to thank everybody on the line. We will continue this next week. Thank you very much for all of your heroic efforts.
Thank you.